Hello, and welcome back to Mammalian Anatomy at Keuka College. We're going to continue our lecture series on the digestive system, and in this video we're going to focus on the pharynx and esophagus. We're going to talk about its different structures, and then we will talk about the physiology involved in swallowing food. We did talk about the pharynx before when we talked about the respiratory system, because the pharynx is actually going to be shared between the respiratory system and the digestive system. Just a bit of review, the pharynx is going to have three regions. It's going to have the nasopharynx over here, which is going to be behind the nose, the oropharynx, which is going to be behind the mouth, and the laryngopharynx, which is going to be behind the larynx. And what are the functions of the pharynx? It's going to connect the oral cavity or mouth to the esophagus, and it's also going to connect the nasal cavity to the larynx. So it's going to be involved in both breathing and swallowing. And so this is one of the reasons why the pharynx is a little bit different based on its tissue structure. Most of the respiratory tract is going to be coated in ciliated pseudostratified columnar cells, which makes sense because the cilia is going to be used to sweep out mucus and debris. But the pharynx is actually going to be coated in stratified squamous epithelial cells instead. And that's because this area is going to have to deal with the friction that is accompanied by swallowing food, and so it has to be abrasion resistant, and so having those many layers of cells is going to allow for that to function. So that's a little bit about the pharynx. Just as a reminder, the pharynx is going to have the pharyngotympanic tube, the opening to the pharyngotympanic tube here. And that's actually going to connect the middle ear to the pharynx, and this will help equalize pressure on either side of the tympanic membrane. The pharynx is also going to contain different tonsils, and those tonsils are going to be tissues that are rich in white blood cells. And this will create a ring of immunity within the throat. The next structure that we're going to talk about is the esophagus. So essentially the esophagus is going to be a long muscular tube that is going to connect the pharynx and the stomach. And its major job is to do the peristalsis of food, or it will move food from the pharynx to the stomach using peristalsis. This peristalsis is going to be a rhythmic contraction of the esophagus that will eventually push the food to the stomach. There are going to be sphincters that are found within the esophagus. The one that I would like to talk about is the lower esophageal sphincter. Also, it's called the cardiac sphincter because it is near the heart. And the lower esophageal sphincter is going to be located between the esophagus and the stomach. And what the sphincter will do is when food has to pass into the stomach, the sphincter will open up, allowing for that passage, but it will quickly close up afterwards. The stomach is actually very acidic. It has a pH of 2. Sorry, thunderstorm. So if that was picked up on the microphone, I apologize. So it's going to close quickly because the stomach is very acidic. It's going to have a pH of 2. And the stomach has a structure that can accommodate for that very low pH. However, the esophagus doesn't have that same kind of structure. So therefore, if the stomach acid got into the esophagus, it can damage the esophagus. Malformations of the sphincter leads to acid reflux, or what we know as heartburn. And so what will happen is the stomach acid will slowly eat away at the esophagus. And after long exposure, it can actually cause ulcers, and it can also cause a disease called GERD, which could eventually lead to being carcinogenic. So, FYI, that's a thing. Before we move on to the next organs, I do want to talk about a bit of the physiology that is involved in swallowing and talk about the different stages of voluntary and involuntary swallowing. So the first phase of swallowing is going to be a voluntary action. Essentially what happens is that the tongue will actually move towards the hard palate, and as it moves towards the hard palate, it's going to push the food, or what is now called the bolus, when the food has been kind of chewed and mashed up, call it a bolus. The bolus will actually be pushed back into the pharynx. So I would take a moment and actually swallow and feel the movement of your tongue. It almost moves like a wave on the surface of your hard and soft palate, and you'll feel that it's pushing material back into the pharynx. It is important to note that there is actually some muscles at the top of the esophagus, and during rest and the voluntary phase, these muscles are contracted to keep the esophagus kind of tight and closed off. So the first phase is a voluntary phase. It's going to push the food back into the pharynx. Once the food is pushed back into the pharynx, there are stretch receptors that are going to detect that there is material within the pharynx, and this will initiate the involuntary swallowing reflex. And the purpose of this reflex is actually to close the air passageways into the nasal cavity and into the larynx, so that food is going to be directed into the esophagus and into the stomach eventually. We don't want food getting into our nose or getting into our larynx and our air passageway. That would not be a good thing. The next phase is that the soft palate will actually rise, and it will close the nasal cavity. So if you swallow, you'll feel that the soft palate will push against the nasal cavity, and the thing that's in the back of your throat, it's called a uvula. That uvula is actually a flap that will raise up and close off the nasal cavity. So any food that we're swallowing isn't going to enter our nasal cavity. I don't know if you've ever kind of laughed really, really hard while drinking some sort of soda or water or something. You may have had it where the food actually goes into your nose. That is, oh, that's so uncomfortable. So that's a situation in which your soft palate didn't close off your nasal cavity. So all of that stuff came out of your nose. The next thing that will happen during this phase is that the epiglottis will bend and close down. It'll bend over the larynx and make sure that food can't actually pass into the air passageway. So food can't go into the larynx and the trachea, and rather the food will be directed into the esophagus instead. Again, this is why it's important not to talk while you're swallowing or eating food, because that will actually open up the larynx and open up the epiglottis, and that could lead to food going down the wrong pipe and that would not be a good thing. Next, what will happen is we'll continue some involuntary phases of swallowing. The esophagus is going to use peristalsis to move food down. This is completely involuntary and we can't really control it. So you'll just have to wait for the peristalsis to move the food down into the stomach. As it gets closer to the stomach, the lower esophageal sphincter will open up and it will allow food to enter the stomach, and it'll quickly close up so that stomach acid doesn't go into the esophagus. So thank you for listening to this video, and I apologize if the thunder got picked up on the video, but what can you do? Can't control the weather. Have a great day and be good to yourself. Bye-bye.